Retirement is often seen as a dream come true, but there are hidden pitfalls that many overlook. Expenses that can quietly erode your financial stability. While Social Security provides a foundation, it doesn't cover every aspect of life after work. From long-term care to rising inflation, these 9 overlooked realities can catch even the most prepared retirees off guard. Let's break down what you need to know to stay ahead. But here's where it gets controversial. Many assume Social Security is a guarantee of comfort, but it's just one piece of the puzzle. Let's dive into the 9 costs that can derail your retirement plans if you're not ready. Medical costs beyond Medicare's reach. Medicare serves as a safety net, but it's not a complete solution. It covers hospital stays and doctor visits, but not dental work, eye exams, or hearing aids. The real shocker, it doesn't pay for long-term care like nursing homes, which can cost tens of thousands annually. Think of it as a partial insurance policy with big gaps. Action plan. If you're still working, max out your health savings account HSA now. These accounts offer triple tax advantages, helping you save on medical expenses while reducing taxable income. Start researching Medigap policies well before age 65 to avoid unexpected costs later. Home repairs and skyrocketing property taxes. Paying off your mortgage doesn't mean home ownership becomes a breeze. Property taxes, especially in popular retirement areas, can rise significantly. But what really catches people off guard are aging systems like water heaters, HVAC units, and roofs that suddenly require costly repairs with little warning. Action plan. Set aside 1% to 3% of your home's value yearly for maintenance. If your house feels too large to maintain, consider downsizing to a more manageable living space. Taxes that don't disappear surprise. Uncle Sam isn't done with you yet. Up to 85% of your Social Security benefits become taxable once your income crosses certain thresholds. For singles, that's just $25,000. Add property taxes, state income taxes, and mandatory retirement account withdrawals, starting at age 73, and you might find yourself in a higher tax bracket than expected. DOLE, action plan. Plan during low-income years to reduce future tax burdens. If you're relocating, research states that offer tax-friendly treatment for retirement income. Supporting aging parents and adult children. If you're part of the sandwich generation, you might find yourself juggling support for aging parents and adult children, navigating job losses or housing crises. Setting boundaries becomes emotionally challenging when loved ones are struggling and you're living on a fixed income. Action plan. Have open conversations with adult children about financial expectations before retiring. Clear boundaries now prevent difficult decisions later. Everything costing more, but income staying flat. Here's the math that should concern you. At just 3% inflation, costs can double in 24 years, a calculation known as the Rule of 72. Meanwhile, Social Security's cost of living adjustments, COLA, often lag behind real expenses, and healthcare inflation runs even hotter. The projected 2026 COLA? Not much higher than last year's, despite rising costs. This gap widens every year, quietly eroding your purchasing power. Action plan. Keep a portion of your portfolio in growth investments. Series I savings bonds can also protect against inflation, since their rate is tied to inflation plus a fixed rate. Getting around when driving gets expensive, cars need replacing every 10 to 15 years, and automotive costs keep climbing. Maintenance, registration fees, and vehicle adaptations for mobility challenges can add up. As you age, you may rely more on rideshare services for medical appointments. Action plan. Plan for at least one car replacement during retirement. Consider moving to a walkable community or area with good public transit for aging in place. Long-term care and nursing home costs. About 70% of those who survive to age 65 develop long-term care needs before they die. Home care costs average $35,000 a year for part-time help, while assisted living averages $70,800 annually. Skilled nursing care can be even more expensive. Action plan. Research long-term care insurance while you're still in your 50s. Understand your state's Medicaid program, as it may be your only option eventually. Losing a spouse, but keeping full expenses. When a spouse passes away, household income can drop dramatically while most expenses remain the same. You lose one Social Security check, and pension plans may vanish entirely. The surviving spouse faces the harsh reality of maintaining their lifestyle on drastically reduced income, often during the most emotional period of their life. Action plan. Review your estate plan now. Consider life insurance or downsizing your home to bridge the income gap. Technology and digital upgrades you can't avoid. Modern life demands constant connectivity. Smartphones, computers, and the internet aren't luxuries, they're necessities. Healthcare increasingly requires digital literacy through telehealth and online portals. Tech support services can quickly add up on a fixed income. Action plan. Budget $50 to $50. $100 monthly for tech needs. Take advantage of free digital literacy classes at libraries or senior centers now. The hard truth. These expenses are coming whether you plan for them or not. The difference is whether you'll handle them gracefully or scramble to make ends meet. Start now. Account for these hidden costs, and remember, successful retirement planning isn't just about accumulating wealth. It's about understanding where that wealth will go. Other stories you might like? About the writer. Kat is a finance writer who's written thousands of articles to empower people to better understand technology, fintech, banking, lending, and investments. Her expertise has been featured on sites like LifeWire and Finder, with bylines at top technology brands in the US and Australia. Kat strives to help consumers and business owners make informed decisions and choose the right financial products for their needs. Article edited by Kelly Susan Wagoner. https://www.aol.com/author/Kelly. Have thoughts or comments about this story or ideas on topics you'd like us to cover? Reach out to our team at